Hi there, I'm Janelle Marie. Welcome to Body Beautiful, the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. With us today, we have plastic surgeon Dr. Joseph Mealy. We're talking about a bunch of different procedures today. It's very exciting. First up, we got thigh lifts, gynecomastia, breast augmentation revision, and then finally tummy tucks. Very exciting stuff. Before we get started, any advice we give you today, you want to consult your own physician. Let's get right into it. Dr. Mealy, thanks again for joining me on Body Beautiful. Always nice to have you here. Now, this is really a cool topic, thigh lifts. Always wanted to talk about this. So first off, who's a good candidate for a thigh lift?
So most thigh lift patients are patients who've been heavier.
Okay.
And the skin has been stretched out by the fat deposits there. And then after they lose weight, the skin becomes redundant.
Yes.
And it's almost like drapery, especially in the inner part of the thigh.
Okay. So where are the scars?
If it's someone with just a little bit of loose skin on the inner thigh, thigh lift is not a good option.
So if they have the loose skin and they don't really need the thigh lift, can they just liposuck it out? Or
yeah, if there's like a small disproportionate deposit of fat, then liposuction works great.
Okay.
Especially if the skin tone is good. Then it just sort of sucks right back to the right shape. But if the skin is out of shape, folding over itself, usually some of that skin has to be removed, so we need to do a thigh lift.
Then where are the scars for a thigh lift?
So a thigh lift, there's two types of thigh lifts. The one I'd like to do most of the time has a scar that runs sort of on the groin, on the inner part of the thigh, and then below the buttocks in the back.
Okay.
And that way you can remove a nice, section from the inner part of the thigh, tighten that all up really, really well. Usually the lateral thigh doesn't need to be lifted as much.
Oh, really?
If it does, then we have to get a little more creative and put scars in different places. The other type of thigh lift has a scar that runs up and down the middle of the thigh.
Okay.
And that's better if there's a lot of extra skin right up the knee.
The middle in the front?
No, the inner part.
The inner part,
between the legs.
Gotcha.
And if there's a lot of skin down at the knee, that probably works a little bit better. But I just don't like the position of that scar. It's just more visible.
But it will lift if you have knee skin that's kind of sagging. It'll lift.
It's more if there's extra skin kind of on the inner part of the knee.
Okay.
That knee skin that's just above the kneecap is pretty tough to fix.
I know, that is a tough place.
And I've seen people make a scar there directly. I haven't done that one. I just don't know if I want to put a scar there. I just haven't seen a knee bad enough where a scar would be a good trade-off.
Let's go to pictures, but before that also what's the difference between a thigh lift and a body lift?
So thigh lift lifts the thigh.
Okay.
Body lift
lifts the body. But the scars
a body
are
lift
different.
does lift the lateral thigh.
Oh,
so
okay.
a thigh lift can take care of the inner part. A body lift can take care of the outer part of the thigh.
So body lift is like pantyhose. Putting on some pantyhose.
Yeah, it actually tightens up the belly, the back, everything all the way around.
Everything nice and tight?
Yeah.
But you probably got a scar on that one.
Yes, there's a scar that runs around like a belt.
Okay.
Yeah.
All right.
So here's
Here we go, first picture.
Extra skin, inner part of the thigh. You can see it's kind of folding on itself, like a little drapery on the inner part. And what I've done is put the incision right in the groin at the top of the thigh, wrap it around the inside, and then below the buttocks in the back, and remove most of that extra skin that we're seeing.
Looks really good.
Got to leave enough so it still holds on. But the problem with the scar is sometimes it drifts down a little bit.
Oh, okay.
It'll be below the bikini line.
But they'll fade, right?
Yeah. And if you're wearing normal shorts, it'll hide it. But it's just if it's a bikini or something cut tight.
Next picture, and downtime also.
So here too, a lot of extra skin. You can see it more on the far leg, the left side of the screen. And then on the right side, everything's tightened up and smooth. It just smooths it out. It gets rid of the motion of the skin too.
Yes. Oh, that's so good.
That really bothers folks. And sometimes it just doesn't fit well in clothes. And by getting rid of that bulk, it really helps.
Another picture? And what about downtime for this?
So here's someone with a little less extra skin. Again, the scar is up high. I think you can see a little bit of it coming down on the,
but not bad
on the
at
left
all.
side. But obviously, she's much happier.
Really
Things are tight. Recovery time is a couple weeks.
Couple weeks for that?
It's usually not really a painful procedure, often done as an outpatient.
Okay, but so what's the recovery basically for then? If you couple weeks, is it for
Couple weeks.
walking?
No, actually walking is fine. You just don't want to do running. You don't want to do a lot of stretching. In that area.
Okay, so no.
And this is someone who has just a lot of fullness in that inner thigh. Even with weight loss, that fat did not want to leave. And fortunately, the skin was loose enough I could remove all of that and bring it all up.
Okay, so you removed it with liposuction, or you just took it out?
No, it's a thigh lift.
Oh, okay.
So you can imagine I just made my incision down below where that crease is and pulled everything up.
Very nice. All right, wonderful.
Thanks.
I'm glad to know about thigh lifts now. For more information about Dr. Mealy, you can just call the office, 925-943-6353, or check him out on the web at either drmealy.com or sanfranciscobreast.com. Lots more coming up. We've got, what do we have next? Just wait and see, because we've got lots to talk about. We'll be right back on Body Beautiful. It's a secret. Shh.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.